The interaction between obesity and mental health often forms a vicious cycle. Obesity can contribute to mental health struggles like depression and anxiety. Mental health struggles can lead to behaviors such as emotional eating or inactivity that contribute to further weight gain. This cycle can become difficult to break without addressing both the physical and mental health components simultaneously. Given the bidirectional relationship, an integrated approach to treatment is important for both mental health and obesity. Here are some action steps to take to mitigate mental health disorders related to obesity. Psychotherapy and counseling. Cognitive behavioral therapy can be effective for both managing mental health conditions like depression and anxiety and addressing unhealthy eating behaviors. Therapy can help individuals build healthier coping mechanisms and develop more positive body image and self-esteem. Lifestyle interventions. Programs that address both mental health and physical health, such as weight loss programs that include psychological support, can be more effective than focusing on weight alone. This might include nutrition counseling, exercise plans, and therapy to address emotional eating or mental health concerns. Medication. In some cases, medications for mental health conditions may need to be adjusted to prevent weight gain, or weight loss medications may be considered alongside psychological support. However, this should always be managed by a healthcare provider. Mindfulness and stress reduction practices. Like mindfulness meditation, yoga, and other relaxation techniques can help reduce stress, improve emotional regulation, and support healthier eating habits. Support systems. Social support from family, friends, or support groups can help individuals address both mental health and obesity challenges. Support groups for obesity, as well as for mental health issues, can be valuable for sharing experiences and coping strategies. The link between obesity and mental health also has significant public health implications. Programs aimed at preventing obesity should consider mental health factors, while mental health programs should take into account the potential physical health consequences of untreated mental health conditions, including obesity. The relationship between obesity and mental health is complex and multifaceted. Both conditions often feed into each other, creating a challenging cycle that can be difficult to break. A comprehensive, integrated approach that addresses both physical and mental health is crucial for improving outcomes for individuals dealing with both obesity and mental health challenges. The obesity crisis is a significant public health challenge that affects individuals across all demographics. But its prevalence and impact vary by factors such as age, gender, race or ethnicity, socioeconomic status, and geographic location. Understanding how obesity affects different groups helps to tailor interventions and policies to address this complex issue. Obesity in children and adolescents has become a growing concern, with rates rising over the past few decades. According to the Centers for Disease Control and Prevention, approximately 19.7% of children aged 2 through 19 in the U.S. are obese. Contributing factors include unhealthy diets high in processed foods and sugary drinks, and sedentary behaviors. Obese children are at higher risk for type 2 diabetes, hypertension, sleep apnea, and emotional and psychological problems such as depression, bullying, and low self-esteem. Adult obesity is an even more pressing issue, with nearly 42.4% of adults in the U.S. classified as obese. Contributing factors include sedentary lifestyles, poor dietary habits, stress, lack of access to healthy food, and genetics. Adults are also more likely to develop chronic health conditions like diabetes, heart disease, and arthritis due to obesity. In addition to physical health issues, obesity can lead to mental health problems like depression and anxiety. While obesity rates tend to decline among older adults, a significant portion, around 40% of seniors, are still affected by obesity. Contributing factors include decreased mobility, loss of muscle mass, and medical conditions that limit physical activity. Health consequences include increased risk of disability, heart disease, diabetes, and difficulty managing medications.